Snapchat filters could lead to body dysmorphia. Oh my God, I want to look like that. And then they go get surgery, they go get fillers, they go get all these procedures just to look like that Snapchat filter. We've seen all these people on Instagram with ridiculous faces. What clinic gave that to them? What clinic allowed this to happen?
A lot of offices are bad at saying no to people. They continue to put more on them when it's not necessary because it's revenue for them.
Welcome back to the YouTube channel. I am so excited for today's topic. This is the channel for everything aesthetics, the latest trends, the latest business advice on what you need to do for this year, 2025. And we're going to be talking about it today with my great friends and colleagues, Alicia and Mitch. I'm so excited to be walking through these hot topics because right now, no one's talking about them. And we're going to start talking about them today because these topics are so important, not just for the public to know, but for clinic owners to know. And I'm very excited to kind of pose these questions to you. But before we dive in, Alicia, Mitch, how you guys been?
Starting off the year pretty great.
Yeah?
Doing good.
Yeah,
staying warm.
Trying.
What's your secret? Because it is freezing outside.
You got to wear your snowboard gloves.
Snowboard gloves. Can you imagine me snowboarding? That would be.
I actually could.
Thank you. I appreciate that. I appreciate
that. It takes effort. I can't see you doing it.
Yeah. This is what I have to deal with every day, guys. All right. Well, listen. I want to talk about this topic because I was overseas when the TikTok ban happened. And when it happened, I was panicking because, I spend a good 60% of my life on TikTok, just scrolling away, mindlessly absorbing the ridiculous entertainment that's out there. But more importantly is, we got TikTok back temporarily. And the fear is, how is TikTok disappearing? If it does, if they don't come to a resolution, TikTok disappearing, how is that going to impact clinics? How is that going to impact aesthetics? And how is that going to impact the doctors that have millions of followers, that are influential, that have really paved a great sort of way in the industry of their knowledge and what they do as their expertise in giving good medical advice? What are your opinions? Alicia, let's start with you in terms of if TikTok is going to disappear for good, what is that going to do?
I don't think that it's going to have much impact on clinics, to be honest. I think clinics promote on other platforms more heavily than they do on TikTok. I think it's the fun little skits to get the patients to understand the clinic on more of a personal level versus them promoting products. I think TikTok will be more of an issue with people that rely on it for their job, with promoting different merchandise and their services, but not so heavily on healthcare, to be honest.
Okay, that's a good take. How about you, Mitch?
Yeah. Well, I think when it comes to social media, I think it's a great way to stay relevant with your current patients. And as far as like lead generation, it's like, well, you have patient referrals, you can local business referrals, and then you have your paid ads or your Google search. And those all kind of get people to you, but social media is where you can stay relevant. Like I always kind of joke, I'm like, we all have a cousin we haven't talked to in 5 years on Facebook. But you see him every day and you're like, oh man, I'm happy for you, right? Like this is going on. And so I think that's the power of social media with clinics and providers is that once someone's a patient, hey, come enter our universe, and then we post. That way you can stay relevant for our new treatments or offers that we have going on. And then every night they're just going to scroll and see you. So, but as far as TikTok goes, I feel like if it's not going to be TikTok, then one of the other tech companies are going to make something, right? Snapchat might make something, or Instagram might make something to fill that void.
Definitely. And I think that I appreciate those opinions. And I relatively agree with you guys. I don't think it's going to be a huge impact on the aesthetics and medical industry. I think we're at this transitionary period in sort of aesthetics and healthcare that the people on TikTok generally are younger. They're the teens, 20-year-olds, kind of creeping up into the 30-year-olds. And if we think about the aesthetic market, if we think about the clientele that the clinics are seeing now, generally it's the 30, 40, 50 plus year old crowd. And so right now, the individuals that are on TikTok aren't typically the ones that are going into the aesthetics practices. So if there is a time for TikTok to be banned, it's actually a good time for it to be banned now because it's not going to make a massive impact. Now, if Instagram was banned, I feel like that'd be
bad.
That would be massive to all the clinics. That's their way of promoting their business.
If Instagram fell off the face of the earth, that would be devastating because that is the crowd that follows and that actually goes into aesthetic practices. Instagram is that sort of middle-aged crowd generally, once again, generalizing here. And so if Instagram or Facebook were to leave and go away, that would be scary. I mean, I'd be freaking out. But TikTok, I think, is a younger generation enough to where we won't see it, because that generation is going to grow and going to overcome and replace the current Instagram and Facebook crowd. So if there is going to be a new platform that comes up that takes over, I mean, this is the perfect time for it to happen. So I'm not terribly panicking. I think clinics have so many opportunities to diversify their marketing. They can go back on Instagram, I think Instagram and Facebook, in my opinion, is what most clinics are using. I don't know from what you guys have seen.
Absolutely. I don't see many like ads posted on clinics promoting themselves on TikTok. And I know for you, TikTok, like you said, you're lost without it, especially while you were overseas. That's like your nighttime downtime therapeutic treatment for you, just to mindlessly scroll to kind of relax yourself.
Absolutely. I think TikTok's great for just that sort of turn your brain off. I personally don't, yes, I'm pretty active on TikTok. I personally don't have an audience that I can engage with on TikTok. I think that everyone on TikTok is just freaking angry. I don't know what's wrong with you guys, but
a lot of negative comments that come out of it.
Constant negativity. And where Instagram, relatively productive conversations, once again, kind of probably correlating to the older demographic that is on there. Facebook, same thing. Not to say that Instagram and Facebook don't have trolls. There are. But nonetheless, I feel like TikTok is just troll central.
They only comment when they have something negative to say. It's not a positive feedback typically.
Correct. Yeah. So, no, that's great. Now, let's kind of transition here to another topic. This topic is something that I feel is a very important one, because it's something that we're starting to see. And I think mental awareness, mental health, mental sort of protection is super important. And why that ties into this sort of conversation is because we're seeing a lot with these filters out there. Snapchat filters. I've used them. I always have fun with my nieces when I see them, and I take these funny photos and make your face all changed up. But also there's filters that make you look younger. There's you can get a Snapchat filter and it makes you look significantly younger and creates this jawline, perfect nose, perfect everything. And it's cool, right? It's fun. However, there's a psychological component to that. I think that there is a sort of transition that Snapchat filters could lead to sort of body dysmorphia and what people are wanting to look like, and like, oh my God, I want to look like that. And then they go into aesthetics, they go get surgery, they go get fillers, they go get all these procedures just to look like that Snapchat filter. What are your opinions on Snapchat filters and body dysmorphia, and if that's a problem, if it's going to become a problem, or if it isn't a problem? Mitch, what do you think?
I guess as far as my opinion, I guess I didn't really have one until this conversation, right? Normally I just kind of joke around on Snapchats and snaps to my friends, but when you say it, I can totally see it. And you start imagining yourself, you're like, oh, what if that could be me? Because I've had the one, it's like the handsome guy. I'm like, man, that jawline's pretty.
I know, right? Yeah.
I'm like, I look snatched, right? Like I look good. But I feel like if someone's already insecure about how they look, I think from what we're saying, I feel like that could advance that. But if someone's in a good place and mentally they're like, hey, this is who I am, this is what I look like, I don't think that'll bother that person. So I think it'll accentuate someone and increase it if they're already insecure about that. Yeah. And I could see that kind of elevating that.
Alicia, what are your thoughts? And do you feel like, kind of piggybacking off of Mitch's thoughts, but also in conjunction, do you feel that these filters increase the demand for aesthetic procedures, or what are your thoughts?
I absolutely do, honestly. I know that I've received some fun ones from you being a cowboy, Sam, and I was like, man, he really wants to be a cowboy today.
Hey, I am a cowboy. I don't know what you're talking about.
But no, I definitely think it's going to have a strong influence over the industry. Before there were Snapchat filters, people were looking at photos of celebrities and bringing it to their doctors and be like, I want to look like this. And I think now they're feeling like they could enhance their own beauty and be like, okay, this is what I want to look like. These are some small tweaks that I want to have. I want to look like this filter, because they can kind of put themselves into that and be like, that's me. I can achieve that. So I think that is going to definitely transition over to more demand in the industry of people wanting to look more like themselves, but having some different defined maybe lips in the pictures. But I also believe that with them wanting to look like these filters, even after they've had these procedures, they're still doing filters on top of it because it's never enough. So I think dysmorphia will strongly
That's what I was going to say. You kind of go down this rabbit hole, right? And do you feel like that clinics are going to face an ethical sort of crossroads where they're starting to be like, all right, well, listen, we can't keep trying to make you look like your Snapchat filter. Do you feel like injectors and providers are going to have or already are facing this crossroads? And what do you think about that?
So for me, I think that a lot of offices are bad at saying no to people, and they continue to put more on them when it's not necessary because it's revenue for them. They're only looking at the amount of money that's going to bring in and not what the patient's results and outcome are going to be. They always want to give the patients what they want and not actually enhancing what the patient needs are. So I think that clinics, many of them look at the perspective of it's money for me, I'm going to do it for the patients. And a lot of times they say, they should not be injecting if they're always giving the patient what they want.
Well, it's hard for them sometimes not to want to do that, right? Because they have bills to pay and staff to pay.
Yes.
And, you're right, though. I think if you're looking at a patient as just a transaction, then you only have a transactional experience. If you're looking at the patient as like a friend, a mentor, guiding them kind of like on their aesthetic and beauty journey, then if you're looking at it that way, then that's when you would be like, hey, Sally, I don't know if you need that, right? Like, kind of point that out. And I think if you make that ethical cut, that's actually better business long-term. Like, short-term, you lose some cash, right? But long-term, that patient's like, okay, they're great.
Right. It's a long-term patient for you. You build trust,
you build trust. And at the end of the day, we're experts, and these injectors and these providers and clinics, they're experts, and they have to give their expertise. And to your point, I think that we've seen it. We've seen all these people on Instagram and TikTok with ridiculous faces. I've posted about it, and I'm like, what clinic gave that to them? What clinic allowed this to happen? And it is, I think, money versus ethics and short-term versus long-term. So it's something that I think that we're going to see a lot more of, the digital era and AI now. I mean, we're not talking about that today. Maybe another day. We'll have to talk about AI. But AI, you can I've seen people post profile photos and it's like their professional photo and it looks flawless.
And you see them in person, and you're like,
see them in person, I'm like, well, that is not you. I mean, I
don't remember meeting you, and I'm like, oh no, you've definitely met them. You're like, that does not look like their profile
like someone
picture.
will add me on Instagram, and I'll be like, oh, that's a great looking person. I see them in person, I'm like, whoa, what happened? And it was because it was
like, who are you?
It was because it was AI, and I think that AI is going to also be a part of this conversation. We're not talking about it today, but I think in the future, near future, we're going to have to talk about AI and how that's kind of changing the sort of hey, I have this photo of me, I can actually AI change it, and I can represent myself in a different way. We can create AI avatars and videos of ourselves and perfect them and make them look flawless. And this is all going to go into the psychology of humankind, and it's very interesting. So let's go on to the last topic that I have for you guys today, and that's about all these clinics have so many services now, right? We see it. They're doing pigment changes and correction with lasers. They're doing hair removal. They're doing weight loss with tirzepatide and semaglutides. They're doing, injectables, body contouring, you name it. The list is so long now. There's so many opportunities to help people look good, feel good, and really live a long life, longer than they were used to, traditionally if they were doing these treatments. So with that all being said, we know there's a lot of services out there. What have you guys seen with all the consulting that we've been doing around the globe, with practices that we've been working with? What have you guys seen with the services that you see that they offer and how they market them? Are they marketing all of them equally? Are they marketing just a few? Should they be marketing just a few versus all of them? We know that the menu's there, but are they representing that menu and correlating it to marketing? Mitch, what do you think there?
Well, I think there's a lot of issues with clinics and marketing, just in general.
Yeah.
But I mean, people typically start with like, okay, let's market discount Botox or laser hair or weight loss, and that's it. And then that's all the patient thinks that you have. And from a patient perspective, they're going to call you and say, hey, I see you have Botox, what's the price? And that's really why you always get that. And then the other mistakes I see is if they do market other treatments, like their RF microneedling or their BBL laser, what they do is they say the name of the technology. I'm like, your patient doesn't know what that means.
Yeah, correct.
Right. Or they'll market like neurotoxin. I'm like,
Right.
that freaks me out. I don't know what that means. And I think a lot of times we're so excited as like the owners of the clinic, you're so excited to share, hey, we have this cool new technology or this cool new thing, but then you're not speaking to a language the patient understands. You forgot
That's
your
so true.
audience.
That's so
You're
true.
so caught up in yourself that you're forgetting the audience.
Right.
Market to the problem.
Like people say chemical peel, and I'm like, that sounds terrifying.
It does.
But if they said, hey, we're going to rejuvenate your pigment, we're going to help, create a healthier tissue. Okay, that makes sense.
Yeah.
Like that's something I would want to buy. But Alicia, what is your opinion on this?
Yeah. So what I have noticed with like the thousands of clients that we've worked with, they're promoting their new shiny toy and they're neglecting all their other services that they have. And what we hear from consultants complaints, they'll say, my body contouring is not selling, or this service is not selling. And I'll go back to look on their social media or even their website. Oftentimes it's not even there, or their social media, it was 3 months ago that they last talked about it. So I think when they bring on a new service or there's a popular service that's doing well, they stick to that to try to make as much money as possible, but neglecting the other services that can co-therapy nicely with this new shiny toy. Instead of talking about it, they're neglecting everything and leaving it behind. So I definitely believe that they need to have adequate amount of time amongst all their services throughout the whole entire month and not blame their marketing company when device is not selling or it's not bringing in any revenue. It falls on the clinic.
What you guys are hearing right now is absolute gold. It's all completely true. We have Mitch that's basically mentioned the obviousness of what's not so obvious, right? We know it's obvious, but clinics not speaking the language that patients resonate with. They're speaking their own language. Hey, we provide neurotoxin. We provide microneedling. People don't know what that is. And then Alicia, you mentioned a great point as well of people focusing so much on the shiny new toy or the new service, and that's it. And then they neglect. It's like the new child that came in, and then the other children kind of don't get as much treatment. And, I think that both of these topics are so important. And my opinion on this is very similar to your guys's. My opinion is that yes, I think to your point, Mitch, is that we aren't speaking the language. I don't like marketing services. I like marketing concerns. When you're marketing a service, people may not understand what the hell that service is. So they're not going to resonate with if they need it or not. But when you market a concern, meaning, do you suffer from fine lines and wrinkles?
Yeah.
Would you like to see more structure in your face? Would you like to repair your tissue? Would you like to bring more smoothness to your tissue? Would you like to lose weight? Versus we have semaglutide. We have metabolism injection. What is that? Right? Like, so market the concern. Do not market the service. When you market the concern, people will be like, I have that. Then they'll come in and then you can talk about all the different options you have. If someone comes in and they say, hey, I saw that ad about fine lines and wrinkles and volume loss. I have that. What do you have? Well, I have Botox, I have fillers, I have microneedling, I have M-Face, I have all these different sort of treatments. And then you can bring out your entire arsenal of opportunities rather than just saying, I have neurotoxin, which no one knows.
No one knows.
So don't market the service, market the concern, and then people will resonate with that concern and come in. That's my opinion on that.
And to tack on, when you market the big shiny toy, you're kind of setting yourself up for failure, because now the patient's going to call and they say, hey, I see you do the RF microneedling. What's the price? How many treatments? And then reception, they start doing the provider's job, and they start saying, hey, you gotta do 3 treatments. It'll be like $2,500. Do you want to come in for a free consult? Okay, well, what did the patient just hear? Oh, when I walk in your door, I'm dropping $2,500.
Right.
And so that's a lot of friction. That's a big ask.
It's a barrier.
And that's going to make me go, I'm going to be hesitant. Like, I don't really know. Let me think about it. And then they hang up, where it's like, hey, like if we market to the concern, right? Then the patient calls about the concern.
Right.
Then we guide them to the consultation. That way we can diagnose the root cause. Now the patient gets education. There's no friction there. What patient wouldn't want to come in?
Right.
And so a lot of times, because you're starting the marketing with the service, you just set up your whole entire patient journey from start to finish for failure. And then you go, oh man, my receptionist is not doing her job right. And it's like, no, she doesn't have guidance.
Yep. It's true. There's no process.
No, and your marketing needs to be a connection to your sales process. It all goes hand in hand.
Yeah.
And that's
so true.
I mean, that's what we talk about all the time with our clients. It's like, you got to think not from your point of view. What is my patient's perspective?
Correct.
And I think that's why our sales and hospitality program is so popular. That's what a lot of these clinics invest in for long-term training for their employees or their team members, to be able to learn how to sell, to be able to learn how to overcome objections, to be able to complete that circuit that Mitch is talking about with the consultation.
No, you guys are perfectly on point here. And the only last piece of advice that actually I just thought of is something that we did. I mean, I know people want to find balance in the way they market their services. And we've talked about marketing the concern. And I think that you can correlate that with having sort of a calendar of marketing for the entire year. January, we're going to focus on this. February, we're going to focus on that. And then have a calendar for the entire year mapped out. Maybe January, we're going to focus on maybe pigment, hair removal, laser technologies, what they do, because in the winter months, those things are sought after. As you're getting into the spring season, maybe you're talking more so about weight management, maybe about body shaping, body sculpting, those sort of treatments, skin tightening also, because people are prepping for warmer weather, going on vacation. And maybe in the summertime, you are starting to market about things that will increase energy. So metabolism boosting things, IVs, vitamin injections, hormone replacement therapy, which should be done all year. And then as we get into the fall, now we're kind of focusing a little bit on that post-summer recovery. So all the summer damage that happened, all the skin pigmentation, all of that sort of thing that happened during the summer, we can repair that with certain sort of treatments that practices may have. In the winter, it's kind of really everything, because the holiday specials are there. You're able to really market everything.
Highlight
so
all your services.
Absolutely. So have a calendar that is actually sort of followed, and you can market the concern based off of a calendar, based off of that seasonality. I appreciate this topic, and I appreciate all of this conversation we had. Any final thoughts on these topics before we close it out for our audience? Any sort of last words of wisdom or thoughts that have been provoked?
To your point with the calendar, kind of putting that out, I always like to see, like, okay, when is Women's Health Month? When is Men's Health Month?
I love that.
Adding and sprinkling that in with the services that you can speak to those patients about, because I think there's a lot of new dates that are on the calendar bringing attention to different services. So I think that's kind of important to add into your point, Sam.
Yeah, love that.
I think a lot of this conversation we had, really, if you bring it back to everything from like reception to marketing to this to all the social media stuff we talked about, it really starts as the provider and owner saying, what is our intention, right? Are we here to serve our patient and guide them on a journey? Or are we just trying to market so we can make a quick buck? And if you're thinking the latter, that's very transactional, and people are smart. People give off energy. You can feel it when someone's really transactional. Then you come in, then you smell the commission breath that the person has, right? You're like, oh God, okay, I get it. You want to pay your mortgage, right? Like, but at the end of the day, when you focus on the service, how can I serve my patient, serve my community, guide them on a journey, serve them on what their goals are and their dream outcome is? Your patient's going to love you. They're going to be happy to spend money with you, and the money you make will follow that. And it really starts with that. What is my intention here? And I think that's the root of it all, like personally.
I love that. I think that
client is important.
Yeah, absolutely. We have to focus on re-engaging patients, not so much get more patients through the door. Getting new leads is important, but why not have a purpose and service our patients so they stay with us? Thank you, guys. This was an amazing topic. I think this was a great conversation. I'm looking forward to having more conversations with you guys in the near future. For all of you, I hope you enjoyed it. I want everyone to engage with us, ask questions, give your opinion. If there's something that's worked for you, if you don't agree with something, let's have constructive conversations together. But before you leave, if you haven't subscribed, what are you waiting for? I mean, come on, hit that subscribe button. We want to make sure that we are following each other's journeys, and I would love for you guys to be a part of our community and enhance it to make this industry better, to make 2025 better, and to help those practice owners who have worked tirelessly to be better. And also, better practice owners correlates to better patient care, which is why we're here. So help us in that initiative. Hit subscribe. I cannot wait to see you guys soon. Thanks for joining us. We'll see you soon.